Every year, millions of seniors head to their doctors for routine checkups, thinking they're doing everything right. And hey, on the surface, they are. But what if I told you that some of the very tests we think are helping us might actually increase your risk of stroke almost overnight? Sounds shocking, right? You trust your doctor. You follow the advice. You do the follow-ups. But here's something most people don't realize: hidden in the fine print of modern medicine are risks that no one really talks about. Not the news, not the health brochures at your local clinic, and sometimes not even your doctor. Now, picture this. You walk out of your yearly checkup feeling fine. Everything seems normal. But a few days later, you start feeling dizzy. Maybe your vision blurs, or worse, you're left wondering, what just happened? The truth is, certain diagnostic tests, especially when done too often or without considering your unique health situation, can quietly trigger problems. Sudden spikes in blood pressure, disrupted blood flow, and in some cases, they may be the very thing that tips your body into a stroke. Now, don't worry. This video isn't about fear. It's about awareness, because once you know what to watch for, you'll be able to ask better questions. You'll be able to protect yourself and your loved ones after 60. It's not just about catching health issues early, it's also about avoiding problems that can happen because of the very tools we use to stay healthy. So today, we're breaking down 5 common medical tests that may carry hidden stroke risks, especially for older adults. And more importantly, I'll show you exactly how to protect yourself before your next appointment. If you're over 60, drop a 1 in the comments. If you're under 60, drop a 0, and no matter your age, hit that subscribe button on Health 365 Day, where we talk about the things no one else will. Let's dive into the first test you might want to think twice about. 1. The CT scan with contrast. If you've ever had a CT scan with contrast, you probably remember that strange warm, flushing feeling. That's the contrast dye flowing through your system. It helps your doctor get a clearer view of your organs, blood vessels, and tissues. Sounds helpful, right? And in many cases it absolutely is. But here's what most seniors aren't told. That contrast dye can silently put extra stress on your cardiovascular system. If you're over 60, and especially if you already have high blood pressure, heart disease, or kidney issues, that little injection may not be as harmless as it seems. Some people experience a vasovagal reaction, a sudden drop in heart rate and blood pressure. You might feel dizzy, nauseous, even faint. Others experience the opposite, a rapid spike in blood pressure, which can cause fragile blood vessels to constrict or spasm. And that's where the danger begins, a higher risk of stroke or cardiac event. A study from the Journal of Vascular and Interventional Radiology found that seniors who had contrast-enhanced CT scans faced a notably higher rate of vascular complications within 72 hours, especially if they had a history of hypertension or impaired kidney function. Let me give you a real-life example. An 81-year-old man went in for a routine abdominal CT scan. He had some mild stomach discomfort. Nothing serious. The skin came back clear. But just 2 days later, he suffered a minor stroke. Doctors believe the contrast dye may have caused a spike in his blood pressure, which in turn triggered a clot that cut off blood flow to part of his brain. Now, let's be clear, CT scans with contrast can absolutely save lives. They can catch cancer, clots, aneurysms. But the key is this: they shouldn't be done just in case. They should be done for a reason. So what can you do before you agree to a CT scan with contrast? Ask these questions. Is this scan absolutely necessary? Are there safer alternatives given my age and health? Can this be done without contrast? Do I need a kidney function test first? In many cases, your doctor can use a non-contrast CT or even an ultrasound to get the info they need. And if you've had reactions in the past, make sure they know that too. 2. The exercise stress test. Next up is a test that seems smart on paper: the stress test, also known as the exercise stress test. Here's how it works. You're hooked up to a heart monitor, and you start walking on a treadmill. As the speed increases, the test measures how well your heart handles physical strain. For someone in their 30s or 40s, this could be a great diagnostic tool. But if you're over 60, especially with high blood pressure or heart conditions, this test could quickly go from helpful to hazardous. Why? Because your heart rate rises, your blood pressure spikes, and suddenly your cardiovascular system is under a ton of pressure. For someone with already fragile vessels, it's like tossing gasoline on a slow-burning fire. Potential risks include sudden arrhythmias, irregular heartbeats. Blood pressure surges in small tears and delicate blood vessels, especially in the brain. A 2020 study in the American Journal of Cardiology reviewed data from over 1,300 patients over 65. Nearly 7% had adverse events during or right after the test, everything from abnormal rhythms to serious blood pressure spikes, and those most affected, people who already had vascular issues. One of our subscribers, Margaret from Ohio, shared her story. She's 74 and has had high blood pressure for years. Her doctor recommended a stress test just as a checkup, but halfway through the treadmill portion, she felt lightheaded and short of breath. They stopped the test immediately, but the next day, she had a minor stroke. Doctors think the sudden spike in her blood pressure during the test may have ruptured a small vessel in her brain. Now, this doesn't mean stress tests are bad, but for older adults, they need to be used wisely. Here's how to protect yourself. Ask your doctor, is this the best way to check my heart, given my age and health? If you're not experiencing symptoms like chest pain or fatigue, ask if the test is even needed. Consider safer alternatives, like nuclear stress tests that use medication instead of exercise-resistant echocardiograms, which assess heart function. While your relaxed goal is the same, it answers without taking unnecessary risks. 3. The endoscopy or colonoscopy with sedation. Let's move on to a test that many folks over 60 are familiar with: the endoscopy, or its cousin, the colonoscopy. Whether it's to check your esophagus, your stomach, or your colon, doctors often recommend these procedures just to be safe, and yes, sometimes that's a smart move. But here's the side of the story most people don't hear. When you're over 60, and especially if you're on certain medications, a routine endoscopy, especially with sedation, might carry hidden risks that no one tells you about. Here's the issue. Most people in this age group are on blood thinners, medications like warfarin, aspirin, or Plavix. They're common for managing heart disease or preventing clots, but when you mix these with sedation, your risk profile changes. Why? Because sedation naturally lowers your blood pressure and slows your circulation. Combine that with blood thinners medications that already make it harder for your blood to clot, and you've got a recipe for trouble. We're talking about things like internal bleeding, oxygen flow disruption, and yes, even small strokes, known as transient ischemic attacks. Or TIAS. A 2021 review in the journal Gastrointestinal Endoscopy looked at patients over 65 who had sedated endoscopies. Researchers found a significant rise in TIA letters within just 72 hours of the procedure. These were often mild, but still very real signs that something had gone wrong in the brain's blood supply. One case that stood out was a 76-year-old woman who went in for a routine colonoscopy. She had no symptoms, was just doing it as part of regular screening. 2 days after the procedure, she began to slur her speech and had trouble walking. She was rushed there, where doctors confirmed she'd had a mild stroke. They believe her daily aspirin use, combined with a drop in blood pressure during sedation, created the perfect conditions for a clot to move and block blood flow to her brain. Again, this doesn't mean you should avoid endoscopies, but it does mean you should make sure it's really necessary. So here's what you can do. Ask your doctor, why do I need this procedure right now? What are the risks with the medications I'm taking? Is there a version of this test that doesn't require sedation? Do I need to stop any medications beforehand, and for how long? Also, know that some endoscopy centers now offer conscious sedation or even unsedated procedures, depending on your comfort level and health status. If you're worried about sedation, ask if that's an option for you. For the MRI with contrast and hidden kidney risks, now let's talk about a test that feels high-tech and non-invasive: the MRI. These scans are fantastic at helping doctors look deep inside the body and often catch issues early. But when contrast dye is added to the procedure, things change, especially for seniors. Here's why. The dye used in MR often contains gadolinium, a heavy metal. The idea is simple: it flows through your bloodstream, helps create clearer images, and is then flushed out by your kidneys. But there's a catch. After 60, your kidney function naturally slows down. And if you already have any kidney issues, even ones you haven't been diagnosed with yet, your body might not be able to get rid of that gadolinium efficiently. The result? It can linger in your body, including in your brain tissue, and that's where the risk starts to grow. In some cases, retained gadolinium has been linked to a rare condition called nephrogenic systemic fibrosis, NSF. It causes skin tightening, joint stiffness, and in more serious cases, organ complications. Even beyond that, small amounts of gadolinium in the brain have been linked to neurological issues, confusion, dizziness, difficulty with balance, especially in those already dealing with circulatory problems. A 2019 study published in Radiology followed over 2,000 adults over 65 who had MRIs with contrast. Within a week of their scan, about 5% reported symptoms that mimic stroke, blurred vision, balance problems, headaches. These weren't full strokes, but they were big red flags. And most of those affected had underlying kidney issues, whether diagnosed or not. Take the story of Harold, a 79-year-old veteran from Arizona. He had an MRI with contrast for back pain. 2 days later, he felt weak, dizzy, and mentally foggy. When his doctor ran a few labs, they discovered Harold had stage 3 kidney disease. No one told me there could be a risk, he said. I would have asked more questions. So, what should you ask? Can this MRI be done without contrast? Can we do a GFR test first to check my kidney function? Have I ever reacted to contrast dyes before? These are simple questions, but they could save you a world of complications. Remember, the MRI itself isn't dangerous, it's the added chemical that your kidneys may not be ready for. 5. The carotid artery ultrasound. Last but not least, let's talk about a test that seems totally safe, the carotid artery ultrasound. This scan checks for blockages in the carotid arteries, which are the major vessels supplying blood to your brain. It's painless, no needles, no radiation. Seems like a great way to catch a problem before it happens, right? Well, it depends. If you're not experiencing any symptoms, no dizziness, no blurred vision, no weakness, getting this test just in case might do more harm than good. Here's why. Let's say your scan shows some narrowing, maybe 50 or 60%. That sounds alarming, but not every case of narrowing needs surgery. In fact, a lot of older adults live with moderate plaque buildup in their arteries that never causes an issue. Unfortunately, once you get this result, doctors might recommend procedures like a carotid endarterectomy or a stent, both of which come with serious risks, include stroke during the procedure itself. A study in the New England Journal of Medicine tracked over 3,000 seniors with carotid artery narrowing but no symptoms. They found that medications and lifestyle changes were just as effective as surgery in reducing stroke risk. Even worse, some patients had strokes because of the procedure. One woman, Helen, age 82, went in for a routine checkup. She felt fine. Her doctor ordered a carotid scan just to be thorough. It showed 65% narrowing. Within weeks, she was in surgery. Sadly, she had a small stroke during the procedure and now lives with partial weakness on her right side. She told US, I wish I'd known I had a choice. So here's your action plan. Ask, why are we doing this scan? If narrowing is found, ask, what happens if we don't do surgery? And always get a second opinion before agreeing to any vascular procedure. Monitoring mild narrowing might be safer than jumping straight to surgery, especially if you're already managing your health well. Let's bring it all together with a message that's simple but powerful. You have more control over your health than you think. Not every test is dangerous, but not every test is necessary either, especially after age 60. That's the piece so many of us forget. As we age, our bodies change. What used to be a harmless scan or quick procedure in your 40s or 50s might carry very different risks in your 70s or 80s, and sometimes those risks aren't talked about enough. A contrast dye injection that spikes your blood pressure, a treadmill test that strains your heart more than it reveals, a sedation that drops your blood flow just enough to let a client move. These aren't dramatic movie moments. These are real things that happen every day to real people just like you or someone you love. And the scariest part, they often happen right after a routine checkup, where you're feeling relieved, confident, maybe even proud that you're taking care of your health. But the truth is, good health after 60 isn't just about doing more. It's about doing what matters and skipping what DOES in single quotes T-DOS. So, what's the real takeaway here? It's this: not all tests are created equal, and not all of them are right for you. Just because a test is available doesn't mean you need it. Just because it's routine doesn't mean it's harmless. And just because it's ordered by a professional doesn't mean you shouldn't. Ask questions. As Dr. Mark Turner from Health 365 Day often says, every test has a ripple effect. It's your job to make sure that ripple doesn't turn into a wave. So before you agree to any scan, test, or procedure, take a pause, take a breath, and ask the questions that could save your life. Here's a quick recap of what to ask. Your simple checklist before any medical test. Why is this test being recommended? Is it to confirm a diagnosis, or is it just routine? If you don't have symptoms, press gently. Is there another way to monitor this? What are the risks specific to my age and health? Be upfront about your conditions: high blood pressure, kidney function, heart problems, medications. Your doctor needs to hear it again even if it's already in your file. Are there safer alternatives? Could an ultrasound work instead of a contrast scan? Could you use light, sedation, or skip it altogether? Could medication simulate exercise instead of pushing your body on a treadmill? Will this test change the course of treatment? If the answer is no, you may not need it now or at all. What would you recommend if I were your parent? Sometimes this question opens up a whole new level of honesty. And here's the most important part. You are never wrong to want more information. Too often, we feel intimidated or rushed. The appointment's short, the waiting room's full, and the thought of questioning a doctor can feel awkward. But this is your body, your life, and your decision. If you've ever walked out of a clinic thinking, I should have asked that, or I'm not sure I need it, you're not alone. And you're not being difficult. You're being smart. Asking questions doesn't mean you're doubting your doctor. It means you're working with them. As a team, a word to caregivers and family members: if you're watching this on behalf of a parent, grandparent, or loved one, your voice matters. To our older loved ones often hesitate to speak up, especially when they feel grateful for medical care or afraid of being seen as a difficult patient. But you can be their advocate. Ask on their behalf. Take notes. Request that risks and alternatives be explained clearly, not just quickly. And if something doesn't sit right with you, get a second opinion. It might be inconvenient, but it might also prevent a stroke, a hospitalization, or months of recovery that could have been avoided. What this video was really about, this wasn't about bashing medical tests, and it certainly wasn't about ignoring your health. It's about context. It's about understanding that after a certain age, the rules change. Your body isn't the same as it was at 45, and that means the way we approach testing, scanning, and screening needs to evolve too. There's a myth that more testing equals better care, but in many cases, the opposite is true. Smarter testing equals better care, personalized care, care that considers your entire story, not just your birth date. A final word from Health 365 Day. If this video made you stop and think, that's a good thing. Maybe it made you feel a little more aware. Or maybe it reminded you of something you or a loved one experienced in the past. That uneasy feeling, that strange symptom after a scan, that question you never asked. Whatever the case, remember this: your health story isn't just a chart. It's yours. So speak up, slow down, and trust that your voice, your intuition, and your questions are all part of good care. If you've ever had a strange reaction after a medical test, or know someone who has, drop a 1 in the comments. If not, drop a 0. Let's open up this conversation for others who might be wondering if they're alone. You're not. And if you want more conversations like this, more truth, more clarity, more practical wisdom, make sure to hit subscribe. On Health 365 Day, we're not here to scare you. We're here to inform you and empower you to make the best choices possible. Because your health isn't just about what your doctor says. It's about what you understand, what you ask, and how you respond. Until next time, take care of your body, protect your mind, and always keep learning.